come in?
Yes.
Okay, wash my hands, close the curtain. Hello, my name is Nicole. I am going to be your registered nurse for today. How are you?
I'm good. How are you?
I'm doing great, thank you. I am going to be performing a head-to-toe assessment on you today. Is that okay?
Yes.
Perfect. Can you please verify your name and date of birth?
Cynthia Rodriguez, 9/18/1990.
Perfect, thank you. Cynthia, you're allergic to anything?
No.
No? Are you in any pain?
No.
No? Okay, perfect. I am going to wash my hands, sanitize, put my gloves on. I'm going to put the side rails down, bed up. Throughout the assessment, I am going to be exposing you a little bit. Is that okay?
Yes.
Okay, do you need to use the restroom before we
No.
start? No. Also, can you please tell me where you are
I am at Baptist Hospital.
and what year it is?
It's 2022.
Okay, patient is alert and oriented times 4. Okay, so Cynthia, I'm going to ask you to please sit down for me. Okay, we are going to start by the head. Okay, head seems equally distributed, no infestations, no bumps. Okay, the head is symmetrical. The skin is normal for the patient's race. Okay. The nose is midline. Go like this. There is no drainage. Okay, I am going to tell you to close your eyes for me, please. Can you smell this?
Yeah.
Tell me what it is.
Coffee.
Coffee. Okay, so cranial nerve number 1 is intact. We also did the Snellen charts prior to this, and it came out stable. Also, the vital signs, we did it previously, and they were stable. So the Snellen charts checks cranial nerve number 2. Number 2 is intact. Also, I am going to tell you to look at this while I go up, down, side, up, and down. Okay, cranial nerve number 3, 4, and 6 are intact. Okay, I am going to tell you to close your eyes. Okay, I am going to say a word and you're going to tell me which one it is. Okay, it's called the whisper test. Okay, cat.
Cat.
Okay, dog.
Dog.
Perfect. Cranial nerve number 8 is intact. Okay, I am going to tell you to stand up for me. Perfect. I'm going to tell you that. We're going to perform the Romberg test. You're going to go ahead and close your eyes, and we're going to check your balance for 20 minutes. Okay, perfect. Now you're going to open your eyes and walk over there. We're going to check for your gait. Perfect, good. You may have a seat. So gait is intact, normal. Okay. Now I'm going to tell you to frown, smile, put your eyebrows up, okay, and close your eyes. Do you feel this?
Yes.
Yes, okay, so cranial nerve number 5 is intact and 7 is intact. I'm going to tell you to open your mouth for me. Okay, I'm going to see. Has all teeth, no missing teeth. Oral mucosa is pink and lips are moist and healthy. Okay, also let's check for the TMJ. Cranial nerve number 5 is again intact. Put your open again, put your tongue out for me, put it up and down and sideways. Okay, cranial nerve. And also look up. All right, now swallow for me. Okay. The trachea is midline. So cranial nerves number 9, 10, and 12 are intact. I'm going to tell you to go ahead and look that way for me, and then the other way. Great. And then I'm going to tell you to push up. All right. So there is no JPD noted, and cranial nerve number 11 is intact. Okay. So I am going to tell you to lay down. Okay, so we are going to check your skin. Okay, one more thing. I forgot something, so I am going to put this light on your eyes to check for perla. Okay, so perla equals round and equal and reactive to light. All right, the skin, I'm going to start with the upper extremities. The skin is intact, no lesions noted, no bruises. Okay. I am going to ask you to sit back up for me, please. Okay. I'm going to listen to your heart and lung sounds, okay?
Okay.
Okay. Start with lungs. Every time I do, I need you to breathe in and out, okay?
Okay.
All right, let's start. Breathe in. Mhm. Okay, now I'm going to do the same in the back, okay?
Okay.
All right, perfect. Okay, bend forward a little bit for me. Your spine is midline. There is no visible lesions or bumps, no bruises. Skin is normal. Okay, now I'm going to listen to your heart sounds. Starting with the second intercostal rib cage with the pulmonic, then the aortic, the Erb's point, tricuspid, and mitral. All right. I am going to check your carotid pulse sequentially. Okay, I'm also going to auscultate it. Okay, and I'm also going to tell you to lean forward a little bit. I'm going to check your apical pulse for 1 full minute. Okay, that's normal. Perfect. All right. I am going to check for deep tendon reflexes, starting with the tricep, then the bicep, and then the radiocephalic, the radiocephalic. Same over here on the other side, tricep, bicep, and radiocephalic. All right. I'm also going to check your brachial pulses bilaterally. They're normal. And then your radial pulse. Also, your apical pulse was 68. Okay. So now we are going to check your abdomen. So I'm going to have you lay back down. Okay. When was your last bowel movement?
Yesterday night?
Yesterday night. Okay. You don't have any problems going to the restroom?
No.
No? Okay. So I'm going to check your abdomen, starting with the lower right side. I'm going to ask you to take first. Okay, so you have active bowel sounds. And now I am going to percuss to her for any tympany or dullness. Okay. And now I'm going to do a light palpation on you, okay?
Okay.
Tell me if you have anything.
Okay.
Okay, that's fine. Let me just see your nails. Let me check for capillary refill. Okay, capillary refill is less than 3. There is no clubbing in the nails. All right, so now I am going to move down to the lower extremities. I am going to ask you to please sit down again. All right. I am going to check for your deep reflex. All right. Okay, so reflexes are regularly bilaterally. All right. Okay, so, and now I'm gonna check for the upper cerebral. So I'm gonna tell you to go like this. All right, and then put, for your lower, put your chin, your feet to your chin. Okay, so they are normal. Okay, so I am going to tell you to lay back down. All right, I am going to start by checking the femoral pulse. This is normal. And then the popliteal pulse. All right, then the dorsalis pedalis, and then the posterior tibia. And they're normal. I am going to check for range of motion in you. So I am going to tell you to push forward with your foot. Okay, that's normal. And then do the same backwards. Okay, perfect. There is no sign of edema on the feet. There is no edema. Okay, I need you to, again, sit down for me. Let's check for range of motion over here. So, push out, and then push back up, okay. So range of motion is normal, it's intact. Okay, so just a couple more questions for you. Do you feel safe at home?
Yes.
Yes, okay. Do you ever think about hurting or doing harm to other people?
No.
No? Okay, so that concludes my assessment on you. If you need anything else, the call line is there, and I'll ask you to please lay back down. Okay, I'm going to put the bed down, side rail up. All right, I am going to wash my hands, document my findings, and that's it.